be characterized by a burning heat in various parts, and especially in the skin, with restless moving and anxiety, especially at twilight. Oversensitiveness of all senses, such as external impressions, light, odors, noises, touch, etc. And later, when organic changes have taken place, the other extreme of loss of motion, sensation, and sensitiveness obtains. In the former state, there is one very characteristic symptom. The patient moves continually, can't sit or stand still a moment. Instead of fidgety feet like zinkum, he is fidgety all over. Phosphorus affects every tissue. The blood becomes broken down or impoverished. Chlorosis and pernicious anemia obtain. Apis and Calicarb also have anemia or a pale, waxy, what is called bloodless appearance of the patient. They all have edema or bloating, and there is one particular difference in the face between them. In Calicarb, the upper eyelids bloat and hang down like a bag of water. Upper eyelids, Calicarb. In Apis, it is more in the lower eyelids. Lower eyelids, Apis. While in Phosphorus, they bloat all around the eyes, and the whole face bloats. Under Phosphorus, the blood becomes so broken down that it will not clot anymore, and we have purpura hemorrhagica. Even in apparently healthy tissues, we have this strong characteristic discovered by Hahnemann, that is, slight wounds bleed much. Slight wounds bleed much. This is what is called the hemorrhagic diathesis, and much to be feared, as many persons having it may bleed to death from any slight abrasion. And this same tendency to bleed extends to fungoid growths like fibroids, fungoids, cancers, etc., and are very dangerous and troublesome. Then again, Phosphorus attacks the bones in the form of necrosis. It is so especially of the lower jaw, but it's also true of other parts as the vertebrae. And I once cured a very extensive and long-standing case of caries of the tibia with it. Fatty degeneration of heart, liver, and kidneys with the characteristic anemic condition should call attention to this remedy. General emaciation, rapid or slowly progressing like atrophy in children, also comes under its tissue-destroying power. And so we find it to be a remedy of wide range and great power. But it's never enough for the homeopathist to know simply the action in general upon any organ or set of organs. He must know how it acts differently from other remedies when acting upon the same tissue or organs. Now, while Phosphorus acts upon the mind to cause great anxiety and restlessness, as in other remedies, aconite, arsenicum, etc., it must be remembered that it is the anxiety and restlessness that precedes another state. So Phosphorus is similar to aconite and arsenicum in its anxiety and restlessness, but we need to remember that anxiety and restlessness of Phosphorus precede another state. Like after the anxiety and restlessness, other states would come. Anxiety belongs to a stage of irritation in the brain and nervous system, which, if not checked, will go on to organic changes, which will be attended with a very different set of symptoms, such as come, for instance, from actual brain softening, in which appears apathy, sluggishness, talks slowly, is indifferent, or won't talk at all. There is one particular symptom worthy of note. The patient fears to be left alone, is afraid of the dark, afraid in a thunderstorm. This is more during the irritable stage of which we have spoken. Phosphorus is a great remedy in typhoids, especially with lung complications. And here we often get stupor and low muttering delirium like lachesis. But while lachesis is worse after sleep, Phosphorus is generally better if he can get to sleep. In the late stage of brain or nervous troubles calling for this remedy, we find the patient losing all ambition to do anything. Either mental or physical labor is shunned. There is great indifference. He cannot think with his usual clearness, cannot apply himself to study or mental operations. Ideas come slowly or not at all. Again, the patient is sometimes amative or, like Hyoscyamus, shamelessly exposes himself. There is no remedy that covers a greater variety of mind symptoms arising from brain trouble than phosphorus. No remedy produces greater vertigo with a longer list of various connections. I have found it one of the best and oftenest indicated for vertigo of the aged. Now, this is what I said before. My father was having this condition, giddiness, and then he felt that his head is empty. He felt an all-gone sensation. There is nothing in his head. And phosphorus helped him. Chronic congestion to the head is characteristic, and the sense of burning in the brain is prominent. For other patients, there would be burning in the brain and a sense of congestion. Heat and congestion seems to come up from the spine. Sometimes it may be like heat coming from behind, from the spine into the brain, into the head. Heat running up the back is more characteristic of this remedy than any other remedy. Deafness is prominent and is peculiar in that it is especially deafness to the human voice, a common symptom in the aged. So there are many kinds of deafness. Here the deafness is for human voice. They cannot understand what the human is speaking. The most frequent use I have made of this remedy in nose affections is in chronic catarrh, in which the patient frequently blows small quantities of blood from the nose. So when you blow the nose, blood comes out. The handkerchief is always bloody. This is my handkerchief. There is no blood in it. But for a phosphorus patient, if they have this symptom, they would have, if they have a running nose, they may have a bleeding nose too. As I said, when writing upon the tissues, the face of phosphorus is characteristically pale and bloated around the eyes. The whole eye is bloated, like the whole face is bloated. Upper and lower eyelids both are bloated. But in pneumonia, we often find circumcised redness of the cheek upon the side of the lung inflamed. So if the right lung is inflamed, as he said before, it is the right lower lobe that is affected generally. Remember, phosphorus is mostly indicated for left-sided complaints, but lung complaints, right lower lobe is affected, like lycopodium and other right-sided medicines. And we know why lycopodium would come into our mind for right-sided and right lower lobe, because it's close to the liver, and lycopodium is a liver remedy. Chelidonium, lycopodium, those medicines are closer to this particular location, which is the right lower lobe of the lung. And here we see that phosphorus also can be indicated, in something that we may miss out on if we do not study the case properly. So whichever side is affected, circumcised redness of the cheek could be seen. This is also true with sanguinaria. Sanguinaria, the medicine that we regularly prescribe for right-sided shoulder pain, right? Pain worse but while doing this and this, right? About the mouth and tongue, I do not know anything particularly characteristic. It has a peculiar symptom of the throat. The food swallowed comes up immediately, as if it had never reached the stomach. So this symptom you may find in gastroparesis. Sometimes it happens, so people who are diabetic, as I said, many diabetic people have phosphorus common symptoms, like they generally are very thirsty, and phosphorus is very thirsty, and phosphorus desires salt. Many of these people desire salt, and if they are chilly, if they feel more, if their complaints increase during cold weather, and particularly cold, dry weather, if they don't like the air conditioner, then phosphorus is very close to them. And And here we have this dryness of mouth and extreme thirst. And then there is this food swallowed comes up immediately as if it had never reached the stomach. So it can happen in gastroesophageal reflux disease also. This is supposed to be due to spasmodic stricture of the esophagus. Under appetite and thirst, we have some very valuable indications for this remedy. Hunger is one. See, diabetic patients have polyphagia, they're extremely hungry. Must eat often or he faints. Right after or soon after a meal is hungry in the night, must eat. He's relieved by eating but is soon hungry again. This calls into mind iodine, chelidonium, petroleum, and arcadium. These are the main medicines for hunger, insatiable hunger, particularly in the night. Iodine, chelidonium, petroleum, and arcadium. The thirst is also peculiar. He wants cold things like pulsatilla, but as soon as they get warm in the stomach, they are vomited. Phosphorus and pulsatilla are very similar. They are both sympathetic to others' sufferings and both outgoing, and both are emotionally vulnerable, weep easily, and they like cold drinks. But pulsatilla, we know, is aggravated by hot weather, warm weather, prefers cool air. But phosphorus is the opposite. Phosphorus prefers warmth and is always cold. Some people have an abnormal craving for salt or salty food and eat too much of it, like Natromure. So salt craving, main medicines are Natromure and then phosphorus. And then there's carbovage too. Phosphorus is a good remedy to counteract the bad effects. Argentum nitricum is also there for desire for salty foods. We have many kinds of vomiting under phosphorus, but nothing characteristic except the one already mentioned. We have already spoken of a hungry, faint feeling in the stomach. Sometimes this is described as an empty, gone feeling, and here again we think of such remedies as Ignatia, Hydrastis, Sepia, and others. But phosphorus does not stop here with this sensation, but extends through the whole abdomen. So some people who feel empty in the afternoon, like at 11 o'clock, they would feel hungry and they want a snack. And it is associated frequently with people who are pre-diabetic. So there are other remedies. Sulfur is there, Ignatia, Hydrastis, Sepia, and phosphorus. But in phosphorus's case, it extends to the whole abdomen, says Dr. Nash. No remedy has this feeling in the abdomen so strong as phosphorus. Now, this is also strong symptom. Like, as I said, characteristic symptom is something that is strongly produced by a remedy. And if it is manifested in a patient in a strong way, we need to match that intensity of the symptom too when we prescribe, or if we want to prescribe correctly. Under stool and rectum occur some very characteristic symptoms also. For instance, stools profuse, watery, pouring away as from a hydrant, with lumps of white mucus like grains of tallow. Stools bloody with small white particles like opaque frog spawn. Stools involuntarily oozing from constantly open anus, or dysenteric stools with wide open anus and great tenesmus. Constipation, slender stool, long, dry, tough, like dog stools. No remedy has a richer array of stool symptoms, and as we see by the above few selected ones, some of them are very unique and have often been verified. It will repay any physician to carefully and frequently look them over. Now the problem is how to get these symptoms from our patients. Like, how do you ask, like, is your stool very dry and tough and slender and long, or is it small pieces like sheep dung? So it's difficult to ask in many cultures, particularly in our culture in India. It's very difficult to ask these stool symptom, and you have to give a few options to the patients so that they can describe. So if it is Natromure, you will say, like, okay, വയറ്റുനിന്ന് പോകുന്നത് പൊടിയായി പോകുന്നുണ്ടോ, വന്നു കഴിഞ്ഞാൽ does it crumble, does the stool crumble? And sometimes we may ask them,